Hello, I am Reagan McCauley from Corey Canine Massage. Welcome to today's interview. A little summary about me before we get started. For those of you who don't know me yet, I am a mobile certified canine and feline massage therapist working in the Toronto area since 2013. I also offer distance Reiki to clients all over the world. I started my business to help pets live healthier, happier lives by relaxing and their physical tension and emotional pain, thereby relieving stress for baby moms and dads too. Boosting quality of life together for longer. And you can find me at coreycaninesmassage.com and on Facebook and Instagram, as well as Twitter, and also Corey Canine Massage's YouTube channel. Today I have with me Vanessa Dubeau, whose dog is used for teaching dog owners how to care for their dogs after orthopedic surgery. Welcome, Vanessa.
Hello, thank you for having me.
Oh, absolutely. This is interesting and very different. So before we get into what this is all about, please tell me a bit about yourself and your background with dogs in general and about the dog of yours who has a job.
Yes. So, as most people that are in a career where they work with animals, it's just kind of been a normal staple part of my life as long as I can remember. I've always had dogs and I've always been involved with dogs. And I got really interested in their anatomy and how they moved and why they moved that way, because different breeds are put together so differently.
Yeah.
And they tend to be affected by different orthopedic injuries more so than others. I started down the rabbit hole of the whys and what became kind of a hobby of learning. The next thing it becomes a formal education.
Yeah.
So
very cool. Okay. And about your dog?
So Bryson will be 8 years old this summer. He's a mix of French bulldog for the most part. And it just so happened there was a need and he was the perfect fit. He's so calm and cool and collected, and he's been like that ever since he was a little 8-week-old guy. And he really not that it's hard for him to love the job, because he gets to lay there, people practice massaging him and doing range of motion and all kinds of stuff on him. He thinks it's wonderful, and to him it's not a job, but I know, it's an important role that he's been able to take on, along with me. So it's really cool how it's all kind of fallen together.
Absolutely. That's great. So tell me a little bit of what's involved for you and for Bryson in being this practice dog for other dog owners learning to care for their dogs that are going to be having orthopedic surgery and then afterwards.
Okay. So, after surgery, obviously there is some basic care that has to be done at home. Mm-hmm. And it's usually, within the first few days to the first couple of weeks, where you're not really going to be putting your dog in a car and moving it around and taking it back and forth. It's not really practical, nor necessarily is it recommended, because it's not entirely safe.
Yeah.
After surgery, you want to protect the joint or the area that's been repaired. So, they really do have to do some things at home. And it's just, your basic kind of, range of motion and massage and some early weight bearing in some cases, and definitely strategies for owners to be able to do that. A couple of different options, environmental there's quite a bit we cover in these sessions.
Wow.
And I want them to come away feeling confident. And there's really just nothing like having some hands-on practice.
Okay. So what are they practicing basically on Bryson?
Yeah, it's mostly the massage, the range of motion, hand positioning, how to hold the leg, what the end range is going to feel like. Mm-hmm. Every dog's a little bit different,
Okay.
And it becomes impractical for them to bring in their own injured, painful dog. They really aren't usually relaxed during these appointments. They don't want to lie down on their side. They don't want to let you have their leg to move it around. They're really guarded and sometimes very anxious. Mm-hmm. So Bryson completely fills that role. He knows to just lay there. He lets everything go loose and limp, and you can move him around in any direction you want. And he's just happy to do it. So there's a lot of coaching involved on how to do the proper movement, where to apply the pressure with your hands and when not, and how to do it safely in such a way that that joint is not going to undergo any undue stress.
Right, right. So knowing what is not overstretch, basically, that kind of thing.
Yeah, and we're really not like, we're just really encouraging all of the tissues to repair and align in a functional way, more so than anything.
Right.
To make sure that we're maintaining some good range of motion, and we're not going to lose range of motion by the disuse that's gone on and continues to go on after surgery.
Right. Is it in part like use in order to keep things lubricated a little bit, and the massage too?
Yeah, a little bit too. The massage plays a role, obviously, in terms of increasing the circulation, warming up the tissues before you come around. But a lot of it too is just to get them in the right mindset that you're not hurting them. We are relaxing. This is a pleasant experience. This isn't going to be anything stressful. And that's something I really emphasize is, this has to be a casual, okay, relaxed experience. And we're not pushing anything to the point of disrupting that, because ultimately making sure that they're comfortable with what you're doing ongoing, you're going to get a lot further, right? To make sure that they're good and relaxed with everything.
Okay. All right. So you mentioned that different breeds are more susceptible than others. Can you give me a few examples of some breeds and why they're a little more vulnerable to this?
For the most part, it's a lot of TPLO. So the tibial plateau leveling osteotomy, that it's the torn cruciate ligaments, which is equivalent to our ACL, our own knee. It's the majority of what we see. It's what I see in these kinds of settings. So labs, lots of bully breeds. There's lots of mixed breeds really too, but yeah, there's just some that are more prone to these kinds of injuries. I have one of my dogs, and she's mostly American Bulldog, and she's had both knees done. So
okay, all right. And I know of a number of dogs too, of course, German Shepherds and Border Collies. Mixed Border Collie breeds and such who have had issues with that sort of thing. You mentioned to me briefly that there are different kinds of orthopedic surgeries. I didn't know if you wanted to cover a couple here or.
Well, this is mostly what we do is it's a lot of knees.
Knees, yeah.
In other locations, apart from where I'm based out of, there's hip surgeries, there's femoral head osteotomies where they remove the actual femoral head, there's hip replacements, there's hemilaminectomy, lots of Frenchies for that one. But there are areas in the Toronto area and Greater Toronto area that specialize more in some of those other surgeries too.
How does a pet parent prep for the orthopedic surgery prior to? Yes.
There's some home environment considerations, really good on floors. In most cases, we need to avoid stairs completely if possible. So a lot of owners end up blocking off stairs at home. They get a small area set up with good traction where they have, limited access to potential risks like jumping up on a couch and that kind of thing. They also need to consider, getting in and out of the car when they're coming home. We definitely highly recommend the use of a sling under their belly to help, keep a little bit of control over that hind end to make sure we're going to protect that. We're coming out of it now, but, slipping on ice and whatnot is a concern over the winter times and continues to be every winter. So that's usually a point of discussion. Things like that to have on hand and ready to go.
Very cool. And then they're educated by you and Bryson about what to do after the surgery, basically. Yes. So how much resting time after the surgery, basically? Like, what's the progression of movement?
They usually end up getting picked up kind of near dinner time. We're through most of the end of the day. There's anesthetic still on board sometimes. So they're a little drowsy. And, we don't usually do much the first day other than some ice. Day 2, though, you can start right away with your ice and your range of motion, very gently, as much as your dog will allow without any discomfort.
Right. And how long-ish is the whole process of rehab and recovery?
It varies by dog. I mean, the session that I do with Bryson is really to kind of cover you for the first 2 weeks while you're for sure going to be at home. And after that, we touch base and we can pick up from there on and kind of gauge how the dog's doing. It can be, I've seen dogs do really well in 8 weeks. It's just, but, and some take
Longer.
It can vary quite a bit.
Yeah. Okay. That makes sense to me.
My whole goal is to make sure they have that really good start early on.
Absolutely.
Yeah.
Know going in what's involved and what to do.
Mm-hmm.
And it just gives them a better prognosis, I guess.
Yeah.
Sure. Yeah. Bryson got involved in this line of work because this is your line of work, basically?
I mean, I kind of have a background more in assisting with human physiotherapy and was in that for about 7 years.
Okay.
After going to school for some human content. And really my end goal was always to end up in the canine rehab. I just took my time getting there. But I wouldn't change any of it. I did go down to the University of Tennessee. I've taken their canine rehab courses and been able to add that onto what I already know. I got in connection with my local veterinary hospital here. I've been there for, I guess we were probably in our 4th year, and started there doing, laser therapy, and we've just been growing it since then. How this particular situation came about where we were doing, because this, I'm not aware, and I'm not saying it doesn't happen, but I'm not really aware of any other veterinary clinic or hospital offering this kind of a hands-on experience.
Right.
It came about while I was actually doing my externship at the University of Tennessee College of Veterinary Medicine. So I was in their rehab portion. And their post-surgical dogs, especially the knee ones, they actually keep them overnight, which is not normal here, not necessarily practical or necessary. But the next day the owner would come in and they'd have this really hands-on experience where everything was explained, and they got to actually try all the different stuff, see how it all works. And just that whole really involved discharge of that patient to home was really detailed, and the owners really came away very well equipped. So I just really loved that, and I kind of wanted to bring that, as an option as part of what I do and what, my local veterinary hospital does.
Right.
It's gone really well. I feel like it's really value added services, and it really opens lines of communication as well. And sometimes I think that's lacking these days. It's just things get so busy. It's kind of an in and out, and I don't want anyone I ever have in my circle to have that experience. I want them to feel like they can just call me up and say, hey, I have a question about a thing. Remember that thing we talked about, and I kind of forgot this or that, and they do, and I think that's really wonderful.
Okay, so how do people find you, and how can they reach out to you?
I do work out at the Uxbridge Veterinary Hospital.
Okay.
Lots of good doctors there. They're really great facilities, really good team. I couldn't have chosen a better spot, I think, to put down roots.
Great.
You can contact the hospital. You can contact me directly. I'm really easy to reach. My own independent business is Kinetic Canine and Equine, but either through Uxbridge Veterinary Hospital or myself. It doesn't really matter.
Okay.
It is a service I will offer. You don't have to have surgery at Uxbridge to benefit from this. It is something I can offer as well for anyone who's taking their dog surgery elsewhere. I just think it's a very educational experience, and it really preps people.
Absolutely. So people whose dogs are going in for surgery, whether at Uxbridge or elsewhere for their knees, basically, they can reach out to you for some education prior to that.
Absolutely. Yeah. I mean, and other surgeries too, but just so happens that is really the most common one.
There's Bryson. Oh, hi, sweetie pie.
Sleeping? Yeah, I think so.
Oh.
So this is the guy.
Ah,
little gray muzzle.
You're beautiful. Yeah. Thank you so much for chatting with me today. This has been great to learn all this stuff.
Yes, thank you for having me. It's exciting experiences.